Well, hi, Tawny.
Hi.
Thank you so much for chatting with me today. So tell me about, where you're from, and what you do, and how you got involved as a advocate for healthcare workers.
Okay. I first want to say thank you so much for being willing to have this conversation with me. Um, I feel like so much of my life, the past few years, I've been attempting to shout from the rooftops about health freedom in general and being able to have a acknowledgement of an identity within healthcare because I feel like so many times patients are kind of ripped of their identity. They become a statistic. They become a part of the informatics of healthcare. They become, the person with heart disease that smoked instead of the grandfather who worked really hard his whole life to be able to provide for his children, and so this is such a conversation I feel like we need to have, especially now as we move more into uh, the technological sphere
Hmm.
that we see healthcare moving into in the future.
Yeah, people before the data point.
Yeah,
Yeah.
yeah. And, um, so much of healthcare is driven by algorithms. And so we lose people as well, their individualness in those algorithms. I never thought I was going to get into nursing. Did not plan to get into nursing.
Yeah.
I had a really horrible experience when I was newly married and 22 years old, and I had a miscarriage. It was really devastating to me. I was away from family. I was going to school in another state.
Hmm.
My husband and I were recently married. Um, I had a degree in psychology and sociology, and I wanted to continue into personality development. And so that was my interest. And I had this experience in the emergency room, and I was like, no woman should
Hmm.
ever experience what I experienced.
Yep.
And so I said, that's it. I'm going into nursing. I'm very lucky because my stepfather was a doctor. My mom was a nurse. My my father is a firefighter, so we always came from this ethos of advocacy.
Yeah, and service and care, direct service and
Yeah,
care.
direct service and care.
Yeah.
And I didn't want that, which is so funny. I wanted to be actually an FBI agent and hunt down bad people.
Yeah.
That was my goal. Um, but it's amazing how a life, something that happens to millions and billions of women,
Yeah.
it was a changing point in my life.
Yeah. It's a big deal. That first miscarriage is really, really hard. I've had one, and
Yeah,
um it's life-changing.
it's life changing. And your subsequent pregnancies are changed by that as well because at least I was worried, am I going to lose the baby today? Is this going to be a premature birth? Is
Yeah.
this, and so you covet every moment you're pregnant with that pregnancy that you're able to bring to term.
Yep.
And so that was how I started into nursing, But as a new nurse, you have all these ideas and you are new to everything. And I actually went directly into the NICU. So I started
Wow.
my nursing career in the NICU
Yeah.
and I stayed in the NICU until about 2014. And that's when the hospital that I worked at took the congenital cardiac babies from the NICU and the congenital cardiac kids from the PICU and created a CVA CEO. And so at that time, I transitioned into the CVACU.
I have friends that are nurses and a cousin who's a nurse. It is a lot of work to get those credentials, to learn all of the direct care procedures and processes. Tell me about like how many years it takes and what kind of training it takes. I don't think people realize that. I mean, like my personal experience is that the nurses were always the most well informed, and they always knew what was going on, and they were tracking um, patients moment to moment. And I was like, well, looking around, I was like, the nurses are definitely the ones running this place. But yeah, tell me about kind of the training and what it takes to become a nurse today.
Yeah, I actually have a 4-year degree in psychology and sociology. And so I have a non traditional track to becoming a registered nurse. But most nurses usually go to nursing school for a bachelor's degree for between 4 and 5 years, depending on the nursing program. And during that time, you are taking very science heavy classes: anatomy, physiology, chemistry. And then in the bachelor programs, you're looking at nursing philosophy, nursing process, even some management classes in there as well. So it is a tough degree. It's a tough degree. I was able to have my bachelor's degree in psychology, sociology. Then what I did is go into what is called a post-baccalaureate program, or it's a program for people who have a degree in something else and they want to go into nursing. And so my cohort was only 40 people. Which is very small. And we went through 15 months of just intensive training. And before that, we had to have all the prerequisites: anatomy, physiology, chemistry, all those things. My course was more on how to be a nurse, like the coursework was more on how to be a nurse. But then after that, depending on where you get hired, you are going through hours of clinical training. And not only are you going through hours of clinical training, you have to go through ongoing training every year because the science of medicine changes. And it's very much evidence-based, practice driven. And so,
And nurses are at the front of the line,
yeah,
or the front of every patient that comes in. It's really a frontline worker position.
it is a frontline worker position. And it's a position where it was interesting that you said that you felt like nurses kind of ran the show within the hospital setting. And the American Nurses Association, I remember when I was going through nursing school, they came out with a statement about how nurses do really run the hospital. It's the processes that happen with a patient from the moment they arrive to the moment they leave is really driven by the nursing process. And of course, we're taking orders from doctors. There's special things that we can't do, we can't diagnose, but we assess and we can make recommendations and so to physicians or physician assistants or nurse practitioners who have more advanced degrees and have that power to be able to make decisions on course of care. But it is very much driven, by nurses within the hospital. Sometimes you lose sight of that as a nurse. That's something that's very interesting, is that nurses tend to have a lot of burnout. There's, first responders can tend to have a lot of burnout. And so if you stay a bedside nurse throughout your whole career, it can be very surprising because, it takes an emotional toll on you, but it's also incredibly rewarding.
I've always been so grateful to the nurses anytime I've had to go in and out of a hospital, because it was, I mean, to be able to juggle the practicality of managing all of the patient processes. There's the human component. There's, you speak with your nurse, you hear care from your nurse's voice. That in and of itself can help you begin to heal and just feel that you're in good hands and that everything's going to be okay. Tell me about, you know, you so 2014 you move into
The CVICU,
the CVICU. You're
which
working
is
with
cardiovascular intensive care unit.
cardiovascular intensive care.
Yeah.
Thank you. And you're working with some pretty challenging cases oftentimes. You love it. I take it. It's
Yeah.
like you just want to care for these little ones, and you're probably learning about
Yeah.
some very complex cases as well.
Yeah. I loved it.
Mm.
It was able to feed my brain because I'm a very curious person. And I, oh, I like the intensity of it too. Um, but I was also able to have the human aspect of it. And there's this one patient that I could think of specifically where after he was born, I was the first bedside nurse to care for him, and I was able to help his mom hold him for the first time and his dad hold him for the first time. And I was able to care for him. And he had a congenital heart defect that is very rare, and the life expectancy is very short generally for these kiddos. And there are surgical bridges to maybe eventually a heart transplant, but that's not always the option for these kiddos. And so I was there for his first surgical repair and
Yeah.
hit the nurse that received him. And it was so amazing how well he was doing. And I became his primary. And so I took care of him every time I worked. And I got to know his family very well. And he had to have a subsequent surgery when I was off on vacation. And I came back after a couple of days after his surgery, and he was on a machine called ECMO. And it's a heart lung bypass machine. And we use it successfully to like rest the heart and rest the lungs, especially after surgeries or maybe when you're really sick, someone's really sick, just to give your heart some time to maybe rest and get healthy again. And he was on that machine, and I just remember coming to me like, what happened?
Yeah.
And ultimately that second repair that he needed wasn't successful. And so I was there when his parents decided to remove him from the machine. And so I was there to help them go through that process. And not very many people can say that they have the privilege of being able to do that. And so
It's such a great responsibility,
such a great responsibility.
and it's the most it's meeting people in their hardest moment.
Yeah.
What is, being in that moment, watching a life pass and, holding the parents and being with them in that moment? How do you find faith or connection to a higher being, or what is that?
It's interesting that you asked that because I grew up in what you would call a Christian household. I went to church with my family. My undergrad is actually from Point Loma Nazarene University, so I went to a Christian university for my undergraduate education. And like everyone, you move through phases in your life where your belief system evolves and changes based on your experience, I feel like a lot of times. And sometimes you attempt to cast away that sort of acknowledgement of what is greater than yourself. But I always felt like the Spirit of God was always calling me back. There was always this return to me sort of feeling deep within. So I definitely have to say, so much of who I became was because of that curiosity about something that's greater than myself. And I feel like people call it different things based off of their own experience or their own knowledge.
Mm-hmm.
Um, I choose to believe that, there is this Holy Spirit, this energy that's connected to all of us. I think nature is a beautiful teacher
Mm-hmm.
in many ways. And so I'm able to really appreciate those moments because I realize that it's it's working into something greater than just myself.
Yeah. Yeah, to be around parents who have so much hope, for and excitement, and then being there um, as that turns and becomes one of the hardest days of their life, and to
Yeah.
be somebody who is in a professional position to care, but then to also bring this idea of something divine, like a divine calling to it, of being there and showing love and care and grace and, the love of God in that moment.
Yeah.
I mean, it's not expected of you as a nurse. That's not your job. It's not
Yeah.
like part of the job description, but to be able to add that very human, deep spiritual connection.
Yeah.
And, you said it was like a privilege to be there to honor that, to
Yeah.
honor what that, calls from us from a deeper place of
Mm-hmm.
connection. It's really beautiful.
Yeah, it's so interesting because I came from this world of, a level 4 NICU, where we do all different types of surgical interventions, and patients would fly from all over the world to seek out medical care from our doctors and the expert nursing care that we would provide these patients. Going from something like that, which I found over time, even though I loved my job, it was more and more difficult to work within that sphere of kind of cold, hard science, the
Mm-hmm.
impersonalness of science.
Yeah.
And after being removed from the bedside because of not getting the COVID vaccine, I um, I was lost. I was lost.
Yeah. So let's talk about that. So you stayed in the special cardiac pediatric care unit. You were there at the time the pandemic
Yes.
hit. So now that's 20 uh 20.
Mm-hmm.
So we're looking at like what, March of 2020.
So, yeah, it's interesting because we started seeing more respiratory cases coming in. 2018 was a bad quote unquote flu season. Um, and then 2019 was less bad. And then, the end of 2019 into 2020, we started seeing like an increase in, the respiratory viruses. What's interesting about that whole situation is that my husband is retired Marine Corps. And so I have contacts and friends all throughout the world, including in Asia. And so, I would talk with them. One of the wonderful things about social media is that you could talk to them, even if they move somewhere.
Mm-hmm.
And so we knew that there was like, I knew at least that there was something respiratory coming on, and we're like, oh, we're going to have another bad flu season.
Mm-hmm.
So, yeah, it was something that I saw early.
Mm-hmm.
I was more aware of earlier.
And as your unit locked down, there were all of these new procedures put in place to
Mm-hmm.
protect both the patients and the
Yeah.
doctors and the nursing staff. Um, you stayed on for quite a while. What I understand is that you followed every single procedure as asked.
Yeah.
And share
Do
with
you
me
want me to
that
go through kind
story.
of that process?
Yeah.
Okay. What was fascinating is that at the Children's Hospital, uh, we had no patients. There were like no patients. You had the typical respiratory patients that you would see, but we didn't have the overflow like we did in 2009 with the H1N1 swine flu outbreak. I mean, I remember our hospital was packed. It was insane. Like every unit, we called them Harry Potter beds. We were like making spots for, people. I didn't see that in COVID at our hospital, at least. But within the hospital organization, we were attempting to uh, change our processes
Mm-hmm.
to make it, safe for the staff as well as the patients. And so, any sort of recommendation that was coming down through the CDC and the health departments, our hospital was really trying to implement.
So that's surprising because, what we were hearing on the news was that there was just this flood of patients in the hospitals, and the hospitals couldn't handle that patient load. But at the pediatric, because you were at a
I'm
pediatric
specifically at a pediatric
hospital,
hospital.
and
Yeah.
at your hospital, March 2020 throughout the rest of the year was not
It was not as bad as H1N1.
right.
And so I just want to preface this with, because I work in the ICU, and there's specific float areas that we go to. So the way a hospital runs is, if there's a unit that is short staffed, and there's a unit with more staff on that day, they will float nurses to the short staff unit.
Mm-hmm.
And so there wasn't the floating going on like
Right.
you would expect to see.
Interesting. So you're seeing what's happening on the news, you're getting directives from the CDC, but your own data shows that this is not impacting children. Is that
Correct.
so?
So my
The same
own
way as is being thought to impact maybe the older population, which was later proven to be
correct,
true. But you're seeing
correct,
this right off the bat.
right off the bat. I'm not saying that kids didn't get sick from COVID. Kids did get sick from COVID. Um, there is something called MIS-C, which is very similar to Kawasaki's disease. It's a massive inflammatory response that kids can have, and it could be very dangerous. And so there were kids that did develop Kawasaki disease. They needed fluid, they needed oxygen, they needed, some of that support. In general, I wasn't seeing kids like I did when influenza hit the
Right.
population, when H1N1 hit the population.
Mm-hmm.
There, the kids were definitely much more sick. And what's really interesting is that even the hospital sent out a letter to the families, because my children use that hospital organization, and within our chart we get messages, and within the chart it even stated, even though COVID isn't as severe for kids as influenza is. Like the hospital even admitted that. But the political announcements that were made, and I say political because it was very much tied to our county supervisors, it became more politicized because politics got involved with
With
it.
healthcare policy.
Mm-hmm.
Yep.
Yeah. And so, unfortunately, that was a very real experience for me. So, as COVID went on, and we saw that it was more the elderly, it was more those who were obese, it was people who had anxiety were at increased risk. So people who had hypertension were at the greatest risk. And then April comes along, and my mother, who is overweight, who has kidney disease, who is on a couple of different hypertensive meds, she gets COVID from a patient. And at that point, in early April, I'm thinking, we don't really know much about this disease.
Mm-hmm.
I love research and I love science and I love reading journal articles. It's like one of my favorite things to do.
Yeah.
And that has a little bit to do with my own personal experience with my children. And so very early on, when one of my friends from overseas were telling me, there's this virus going around, I started looking at what are all the natural remedies that I could do to help boost my natural immunity. And especially my parents, they were who I had greatest concern for. And I knew vitamin D, quercetin, vitamin C.
Zinc was a big
yes,
one. Yeah.
zinc. Like these are all these supplements that I told my family, like, you have to buy this. I remember making Facebook posts to like all my friends, like, this disease is coming. You have to get these supplements.
Boost your immune system.
Because I do believe that terrain theory is a theory that isn't well acknowledged, but we need to explore more. And that's the idea of, there's different microbes out there everywhere, but the host can really determine if contact with that microbe will become a disease process versus just, contact and move on with life. And so I had my mom, I was making my mom take all these supplements. And she's like, I don't know, Tawny, this is a lot. And I'm like, you need to take all these supplements.
Yeah.
And the other thing I told her to do was to take aspirin, because I had heard that there was a concern with platelets and clotting. And so she was like, my kidney doctor says not to take aspirin. And I'm like, Mom, taking a baby aspirin every day, like, I really do recommend it. I mean, you get COVID and you die, or you like, take this medication and you're getting all your labs drawn every 6 months or so. You'll know if you have a change in your kidney function. And so she was like, okay. And, she's a nurse too, so she knows these things, but she's also maybe a little less inclined to follow more of the holistic approach. And I think it's just because of her age. So she did. And she got COVID. And she did amazingly well. She was, the other thing too is that she did need to go into, the emergency room because she really needed steroids. And at that time, it was recommended not to give steroids, which is bonkers to me because, you treat the symptoms. With any sort of virus, you have to treat the symptoms. And so she had an amazing emergency room doctor who also handed her his own write-up of like different vitamins to take, different things to take. And he gave her some steroids and gave her some fluid, and she went home and she did great.
She made a full recovery.
Recovery.
It was a really bad cold, it sounds like, and she beat it.
And I was like, oh, people are surviving. Like, if my mom could survive with the supportive care and some natural supplementation.
Yeah, and pre-existing pretty serious conditions.
Yes. All the pre-existing conditions that are, a death sentence.
Yeah, when paired with COVID-19.
Yeah, when paired with COVID. Yeah. And so that really kind of solidified my my belief that we weren't being told the whole story. And so, and that people didn't have to die.
Right, with the right set of care.
With the right set of advocacy, people didn't have to suffer. And so, 2020 continues, and pretty quickly within 2020, a vaccine was being discussed.
Yeah, Project Warp Speed.
Yeah.
Under President Trump at the time.
Yeah, yeah,
Hmm.
was being discussed. And due to my experience with traveling to Washington, D.C., and the CDC and Sacramento in the past for health advocacy, I was very skeptical of what was going on.
Hmm.
I have to tell you this story because it was probably one of the most influential, personal, I don't even know how to describe it. It was like visceral experiences that I ever had. And so I traveled with a group of people to Washington, D.C. in, I want to say it was like February timeframe of 2019. So this was before COVID. And Dr. Fauci had, and I think it was Laura Mercier, who was in charge of the ACIP committee within the CDC. And then Fauci is at NIH. And they had traveled to Washington, D.C. to discuss with a congressional committee about the need for increasing funding. And there were questions about vaccines that came up. And I will never forget, I was listening to the hearing, and one of the questions that came up was about the MMR. And the question was, does it cause encephalopathy? And Fauci said, no, it doesn't. And Laura Mercier, like, literally turned to him like this, like, stared at him, like, I can't believe you just said no to that, because on the vaccine insert, it says that
That's a risk.
encephalopathy. I mean, you're paid by the vaccine, forget the name of it, but you're paid out if you have encephalopathy after getting the MMR by the government as a vaccine injury. And so the fact that he said that at Congress, I was just like, I can't believe he just lied like that. You know, there's
Yeah.
a part of me where I'm like, as a scientist, you seek truth, right?
Hmm.
And so I just remember watching that and thinking, I cannot believe he lied about that.
Yeah.
And then there was going to be a help meeting with the Senate like a week later. And I was like, we have to get there. We have to get to that Senate hearing.
And the feeling is that if that response is being said at that level so quickly,
Yeah.
it starts to beg the question of, is this becoming a norm within
Yeah.
our system that you can, at the highest level at the NIH, at the highest level of government testimony, say something that, at worst is an outright lie, at best is a half truth,
Yes.
right?
Yeah.
This is an indication, right, of something else. This
Yeah.
is cultural.
Mm-hmm.
And so your feeling in that moment is like, my gosh, like this doesn't seem normal. There's something signaling
Yeah.
concern.
Yeah. And not
Yeah.
only does it not seem normal, but that it's a culture of it's okay to lie. It's a culture of it's okay to tell half truths to be able to get what you want
He was testifying for more funding. Is
for
that
more
right?
funding.
Okay.
And tying funding with lies or half truths is such a dangerous trajectory. And so I remember getting on the phone with a couple of my friends from around the country because we all kind of found each other in advocacy because of different things that had happened to either our family or that we witnessed with family members or friends, close friends. And I remember saying, like, we have to get there. Like, how can we get people there? And they were like, let's get on it. And we were able to get thousands of parents at the help hearing. And I would love to show pictures
Yeah.
sometime. I would
Send
love
them
to show,
over.
yeah, I would love to show you pictures because we got so many people in such a short amount of time, filled the halls, and that they sent in police officers, and they were literally like elbow to elbow with all their plastic like cuffs
Oh my
in the
gosh.
hallway, circling the hallway, because there were so many people there and they didn't expect it. And there was
Wow.
every single news, like CNN, BBC, Reuters, Al Jazeera, I mean, like Fox, every single news publication you could think of came. And I remember walking over to one of the police officers and asking him, I'm like, is that because I don't go to Washington, D.C.? I mean, I'm a mom. I'm a mom and a nurse. And
Yeah.
like, that was my sphere.
Yeah.
And I lived a really cozy life in that sphere.
Yeah.
And I'm not into politics. Like, I have no idea what that means
Yeah.
to be political. But I remember walking over to the police officer and I was like, is this common? Like, do you typically have this many people for these types of hearings? And
Yeah.
he was like, no, ma'am. And I'm like, well, is it like more, less? And he was like, the only time I've ever seen this many people for a hearing is when Kavanaugh was being questioned
Right.
and when Hillary Clinton was being questioned with Benghazi.
Yeah.
And at that moment, I was like, we saw that news coverage 24/7 for days.
Mm-hmm.
And yet, all we have the same amount of people, and they're just moms and dads. And they literally came from every single state. We got people from Alaska, we got people from Hawaii.
And what drives people to come to something like this, something on the level of Kavanaugh and Benghazi? Like, what drives these families to come? Are these families that have had adverse reactions to medical care? Like, is it, do they understand something maybe not everybody else does? I mean,
I think, well, many of these families were parents of children who had chronic diseases. And many of these kids who they feel like were either not treated well by the medical system or cast aside by the medical system. And, these moms and dads are some of the strongest people you'll ever meet because they've had to fight against censorship. They've had to fight against their own family and friends' disapproval.
mm-hmm,
They've had to fight against society's judgment.
mm-hmm,
And so a lot of these families have this very internal strength,
mm-hmm.
because so many of the pillars of what makes a person have been kind of, that support has been stripped away.
Mm-hmm.
And it was getting to a place where families were becoming very concerned that they weren't going to be able to make decisions for their children, health decisions for
So
their
what
children.
year was this? This is
19.
2019. So this is even well before the pandemic.
Yes.
There's a movement of families that are watching very vigilantly what's going on
Yes.
with government agency funding as it relates to research,
Yes.
vaccine development,
Yes.
and just general spending.
Yes. Funding is where the trajectory of science goes.
Mm-hmm.
It's kind of the carrot that leads the rabbit. These families realized that they had to get political because no one was funding them. They didn't have pharmaceutical manufacturers funding them. They didn't have doctor organizations funding them.
Yeah, this is a purely grassroots,
Purely grassroots.
finding each other
Yes.
through
Social media.
social media or through word of mouth,
Or
right?
through
Like,
word of mouth. Yeah.
I had no prior connection to this community until a year and a half ago. And it was through referrals of trusted friends that connected me to very powerful families, actually, in Silicon Valley that had driven the conversation underground. But when they understood how much I was hurting, it was almost as if I was being connected into this support group
Yeah.
of people that had either been on the journey or many years ahead of me on the journey, witnessed that I was really eager to help my child and invited me in very gently, to be honest. It was not like we're going to feed you this information because this is what happened to you. It was more like listening, like my story, pointing out, well, that might be a clue.
Yeah.
That's a clue. And here's some medical literature as to, why that febrile episode is a clue.
Yeah.
Right. I've never once have felt that the community of affected families has ever pushed information on me so much as advocated for each other. Right.
Yeah.
And that's the sense that I've always had.
Yeah. I mean, definitely you learn you have to advocate for yourself because you don't have these other powerful institutions advocating for you. And so
and your doctor's not advocating for you in most cases.
No, they're not, unfortunately. And I could tell you other stories about that, but let me just finish this one because it's really a pivotal moment. And it's what got me through some of my darkest hours during COVID. And so you have all these people, and I was amazed about how the politics of getting into a committee hearing works as well. Because when we first contacted the committee, they said, oh yeah, there's 100 seats in the galley, like first come, first serve. Well, when you get there, there are people who are standing in line as placeholders that are literally being paid. They come with their folding chair and their book, and they're paid however much money by whatever individual who wants to get into the hearing for whatever reason. But they don't want to stand in line, or they're not invited by, one of the committee members. So they pay placeholders, which I found to be fascinating. And, they know how to get a place. So they're there first thing in the morning, and something that many families don't know. You know what I mean? The average American citizen does not know that. So that was really enlightening to me.
In this case, who do you think paid those individuals to come and
some of it was
placehold?
reporters.
Okay.
Some reporters, and then some lobbyists as well. And that was just through figuring out who was switching spots before they went into the hearing.
I wonder how they recruit for those people, or what they call that job.
I don't know. But,
congressional squatters.
Yeah, right? I know. I'm like,
space squatting.
I would love to do that. I love to read. Right. I'll sit there.
Yeah, and you can learn in the background.
Yeah. You get to, hear the conversations of the people passing by. Yeah, so that was really enlightening. And then what ended up happening were those spaces of 100 people. When the committee members found out how many of us were there, they filled every single seat except for 10 seats that were, for these thousands of people that came. So we couldn't even get in. 10 of us got in. 10 of us were able to get in.
And everybody else is in the hallway being surrounded by police.
And we're all on our phones, watching the hearing, as it's taking place in there. And we're talking to each other, and we're making connections. And some of us who just knew each other through social media, we're like, oh my gosh, I talk to you every day. And I actually get to meet you person to person, which was amazing because for so many years we were called Russian bots. And so specifically by a woman who is actually at Stanford. Her name's Renee DeRista, and she is very well known within the Twitter files and trying to curb the American voice.
So posts and things from your community were called Russian bots.
Yeah. Russian disinformation,
Yeah.
Russian bots.
But these are all people.
Yes.
And you know them.
Yes.
Yes.
And I'm one of them.
And you were called a bot.
Oh, yes. I mean, like, or they would tag in social media and be like, oh, this is a Russian bot account.
Yeah.
Or, we were like taken down because of disinformation or whatever it is. And a
Yeah.
lot of times it was just communication within our own groups.
Yeah.
I was in Facebook jail more times than I wasn't in like 2018-ish timeframe. 2019.
Is there a due process at all before you're taken down, or is it just gone? You like
It's
log
just gone.
in and it's gone.
It's just gone.
Jesus.
It's just gone.
Yeah.
I felt like that was my voice and my experience that was being quieted, by someone who was so insulting. It was so insulting.
You're a
to me.
frontline healthcare worker.
Yeah, it was so insulting to me. And it was so insulting to me that I went to Feinstein's office, who had Renee DeRista testify before Congress about Russian disinformation and bots. And I went to her office and I was like, I want a meeting. She's my senator.
Yeah.
Of course, you don't get a meeting with, Dianne Feinstein. So I was like, okay, well, can I have a meeting with her aide? No, there's no one available to speak with you. And I was like, okay, well, I just want everyone to know that I am not a Russian bot.
Yeah.
I am a real person. I grew up in California. My grandparents, grew up in California. My parents grew up in California. I am not a Russian bot. I am an American citizen, and
you're
I
being
have
censored.
this experience, and I am being called this. And
Yeah.
I am not.
Have you ever looked at, were there Russian bots at all involved in your community? Like,
So I don't
you
have the technological experience to be able to say.
But just post-wise, did you ever see anything within your
No,
groups?
because I ended up meeting so many of those people that I actually had conversations with that we found through social media. And we traveled to Sacramento together, and we found, and we would be like, okay, let's meet up here. And we found each other, and we were all very real people.
Yeah.
We were not Russian bots. But I do have to say, I was just laughing so hard inside when I flew up to Sacramento for a hearing up there, and there was a huge Russian population that came to the hearing because they said, we escaped from Russia because of the censorship that happened and the lack of medical freedom in Russia. We are very concerned about this trajectory and laws that Sacramento is writing and passing. And it made me laugh so hard because I even texted my friend. I was like, I found the Russians.
Yeah. They're not bots. They're immigrants.
Yes.
And they're, not participating online, but they're actually aligned with, individual freedom, which is why they left Russia and came to the United States.
They're aligned with the American dream. They are here.
Yeah. And you probably have looked at the comments, because my understanding is that these, Facebook groups, people are pretty on top of who's in it.
Yes.
You're going to people's pages, looking at who their friends are.
Yes.
Pictures of family members.
Yes.
And if there's anything weird, often, my understanding is that these groups are very vigilant as to who's there and why they're there.
Yes, very, very vigilant, because we don't ever want to be mistakenly aligned with something that is nefarious, and we don't want to be aligned with anything that's illegal or questionably ethical because of that reason, and going back to Washington, D.C., so everyone leaves at the end of the day. It's like 5:30 or 6 o'clock. And one of Nancy Pelosi's aides comes up to a small group of us. There was maybe only 4 or 5 of us. And we were just talking about dinner. What are we going to do now? And she said, I want to ask a couple questions of you guys. And I'm paraphrasing everything. She basically said, if we dropped vaccine mandates, would you be for universal health care?
Mm-hmm.
And we all kind of like looked at each other and we looked at her and we were like, no. And the reason why, it's not that we're against healthcare for everyone. We believe everyone should receive healthcare. What we are against is government determining what that healthcare is. Because our families, our children, our spouses, our friends, our family have been injured by the healthcare industry. And the last thing we want is the government to be in charge of it.
And if they're in charge of all the funding for it, that's where the concern comes
That's
from.
where the concern comes from, because
Mm-hmm.
then the doctor will be the employee of the government
Mm.
and will not, as we see, be independent in their practice. And her response back to us was, how strong is your family?
What did she mean?
We didn't ask her to clarify. It was one of those things that we were shocked about it. So that's the beginning of 2019.
Mm-hmm.
And going into the end of 2019 and into 2020, and all of these different mandates of how we were going to live, and then the ongoing pressure of separating families and friends. You're on one side or the other side.
Right.
It became a mantra. And my friends and I, something would happen to us and we'd be like, how strong is your family? It
Mm-hmm.
became, how strong is your family?
The
Like
mantra, how
the
strong
mantra,
is your family? Mm-hmm.
something that might have been really negative
Yeah.
in connotation, it became almost like our battle cry. Like our family is going to stick together through this. Our family is not going to be separated, whether that family is made up of our friend family or our biological family. How strong is your family? Our family is iron strong.
Yeah. And I mean, this is a time now in 2020 where, you couldn't visit a dying family member if they were in the hospital to say your goodbyes. So, this is okay. So I'm kind of seeing now as lockdown happens, you're already kind of keeping an eye on things. You're at the hospital, at a pediatric hospital, where you're noticing that COVID-19 is not impacting children severely. And then you're able to heal your own mother who had every comorbidity with a COVID-19 diagnosis. And she made a full recovery pretty smoothly, it sounds like.
Yeah.
So now tell me about what happened when they started mandating vaccines for frontline healthcare workers.
Okay. So, December of 2020 was when the vaccines were being rolled out to frontline workers.
Mm-hmm.
I also noticed, because I'm more vigilant, just because of my skepticism. I was so trusting, so naive and trusting 10 years ago. But I just became very skeptical of everything within healthcare. And I started kind of just keeping a mental track of things that were going on. The vaccines were supposed to be for only first line workers, but I remember traveling in the hallway of the hospital. So I was also I was a resource nurse for my unit. I later became a charge nurse for my unit. So sometimes I'd have to go off of my unit to retrieve things like blood products or something like that. And I remember being in the hallway and no one was like allowed in the hospital unless you were a parent of a child. You didn't have like visitors wandering around. And I remember this elderly gentleman coming up and asking me where a certain room was in the hospital. And I knew that that was the room that the healthcare workers were getting vaccinated with. And I knew that he wasn't a healthcare worker for our hospital because he would have known where that room was and he didn't have a badge. And I remember saying to him, well, I know where that room is. Are you sure you're supposed to be going there? And he said, yes, I need to go there. And I was like, okay. So I kind of guided him to where it was. And I remember thinking, gosh, he's getting a COVID vaccine. I wonder who he is. And I remember thinking whether someone wants a COVID vaccine or not, whether someone wants any sort of medical care or not, that's not for me to determine. That's for the person to determine. I am a staunch believer in medical freedom.
Yeah, and that means getting the vaccine if you
That
want
means
it.
getting the vaccine
Yeah.
if you want it.
Mm-hmm.
But I also thought how unfortunate that he is able to get it when maybe someone else isn't that would want it.
Do you think it was like a friend or a family member that said just sneak in at this time? And
I don't think it was a friend or a family member from the nursing staff.
mm-hmm.
It could have been maybe someone who helped fund the hospital institution.
Oh yes, I remember that too up north. That
Yeah.
if you had funded or you were involved with the local hospital or you're a donor, you could oftentimes
Yeah.
get ahead of the line a little bit. I actually do remember that time.
Yeah.
Mm-hmm.
Yeah. And so I remember thinking, like, oh, this is just another example of our warped system, you know? And but then the hospital really pushed the staff to get vaccinated. And it became almost like this huge marketing, gimmick pretty much. There would be signs where they were getting vaccinated. There would be signs of like, take a picture with your Band-Aid and like talk about the COVID vaccine. And so it was all free marketing pretty much. Like the healthcare workers were doing free marketing.
And it was aired all over the news when that was happening.
Everywhere.
And it was really viewed as this moment of accomplishment.
Yeah.
And people were excited and they were grateful. And this meant maybe we didn't have to lock down as much.
Yeah.
And so
And that's what we were told, right?
Mm-hmm.
That's what we were told. Like, you get your vaccine, you basically get out of jail free card. It's like you get to
You have your freedom back.
experience society again. And I knew that the vaccines were mRNA vaccines, and I knew from my own research that that's a gene therapy. It's traditionally gene therapy. I didn't see that as a vaccine. And then we saw the changes in the descriptions of the vaccines. And then we saw the changes in descriptions of, what constitutes a COVID death. And so all of these things were going on. At the same time, I was kind of witnessing what I was witnessing. And then I was taking care of children with COVID, by this time. And it was really interesting, too, because I was able to be a part of some of the science of doing the testing, because the hospital that I worked for was helping qualify the machines, the testing machines, as being certified in CDC's view. So there was so much going on, and I would call down to the lab and I would be like, I just don't understand this. Can you explain this to me? And everyone was so excited about the technology. So I was able to just talk to people about it. Then they started vaccinating kids in, I want to say May-ish time frame.
Yeah.
In 2021, around May, June, around that time.
Yeah, I remember it wasn't tested yet and available for safety for children at the beginning of the year, because I remember trying to figure out, there was pressure for me to vaccinate my daughter with it. And so, yeah, it was like Q2 of 2021 that it had been approved for children.
Yeah. And I remember thinking oh, this isn't good. This isn't good. And we started seeing, because we're a CVICU, we started seeing myocarditis cases coming in. And many of the kids were healthy kids. And not just myocarditis, a lot of the girls we saw were coming in with ventricular arrhythmias. I mean, they had myocarditis, but they had some of the boys didn't have the ventricular arrhythmias I saw with girls. They had, especially teenage girls,
Yeah.
they were having some ventricular arrhythmias.
Which presents as almost like a panic attack, right?
Yes,
Yeah.
yes, yes. And I and we were getting a lot of them. And my friends and I started keeping count of the kids coming in, and their troponins would be, some of them would be so high, and you would look at them and you'd be like, oh, this child looks totally fine,
Yeah.
or he's not having arrhythmias. Like, is his troponin really 13 when normal is like less than 0.05 for our
What is
testing?
troponin?
Troponin is it's a cardiac enzyme that's released when the heart muscle is damaged,
Okay.
and it's specific to the heart muscle.
Interesting.
So there's other inflammatory chemicals that we could look at in the blood that aren't as specific, but troponin, if you have elevated troponin, you're having a heart attack, is
Yep.
what it's traditionally associated with.
Right. And so you're seeing a lot of these in the labs come back of kids who otherwise seem very healthy.
Seem very healthy. Some of them were in their sports uniforms, their soccer uniforms,
Yeah.
their baseball uniforms.
And they're coming in because they're complaining of chest pain.
Chest pain, severe chest pain, shortness of breath. The ones that have really damaged hearts are coming in with lethargy and not being able to keep food down. That's something that I think a lot of people don't realize, is that children present more with stomach issues, more like a stomach virus issue, when you have severe myocarditis or that develops into more like cardiomyopathy. They're not able to eat because they just don't have the perfusion to their gut. But their other organs are young, and so you don't have, you do see some fluid retention, but not really very much. It's not like an older person that has myocarditis or cardiomyopathy. And so, we start seeing these kids coming in. And I remember going over to one of our pods that held some of these kids, and the hospital that I worked for decided to do research on these kids.
Yeah.
And the researcher is world-renowned researcher in Kawasaki disease.
Yeah. Sorry.
That's okay. That's okay.
This is where it's when you. This is why so many people you're hearing this story can't turn away.
Yeah.
Once they know it.
Yeah. I've shed so many tears. Like, I've shed so many tears, but I feel like
It's incredibly frustrating.
It's incredibly frustrating. And so I go and speak with this researcher because, once again, I'm curious. Like, I'm curious about everything. Yeah. So I go over and I start talking to her about what she's looking at in the blood.
Yeah.
And she names off, I can't remember exactly what she names off, but she names off a couple of things that are inflammatory markers that are associated with mitochondria. And through my research on vaccines and inflammatory responses, mitochondria are an amazing intracellular bacteria.
Yeah.
All my friends know how obsessed I am about mitochondria.
I'm a fan too.
Yeah. And so, so it's so funny because I'm like, all roads lead to mitochondria, all roads.
And because every cell in our body has mitochondria, which is oftentimes defined as the energy or source or the battery of the cell. And then what we realize the mitochondria are doing is it's actually taking energy in and then signaling through ATP in the Krebs cycle.
Yes. And signaling, I mean, cancers are because you have sick mitochondria. The p53 gene is disrupted, which is, there's so much about mitochondria.
Yeah. It's all heritable from mothers and
Yes, yes, and
mhm.
there's things that you could do to make your mitochondria healthy or
Yep.
sick. I'm so fascinated with them. So I've read a lot about them over the years, and when she was talking about these different oxygenated stress enzymes that are found in the blood, I was like, "Oh, it's all related to mitochondria." And she was like, "It is." So then she realized that I understood what she was researching, so she was willing to talk to me more about it. And ultimately, she said to me, she said, I know this isn't what I should be saying, but if I had a boy, I don't think I would vaccinate him. She's like, I would maybe vaccinate him with one COVID vaccine, but I wouldn't do two.
One dose because there was, they're recommending
Yes,
3.
yes,
Okay.
yes. Well, at that time, they were recommending two.
2.
If you were to get the mRNA or the Johnson and Johnson, which was one, but
Mhm.
she was specifically talking about the mRNA
Yep.
vaccines, which are 2 doses, which make one, I guess, one series. And she said, I definitely wouldn't give them 2.
Mhm.
I didn't want to press her too hard, um, but at the same time, she was telling me that the hospital was partnering with our local government to push the vaccines and to really make it mandatory within the schools locally. I was so disgusted by that.
Mhm.
And they had doctors getting on, who I might add, the doctor that's affiliated with the hospital was also affiliated with UCSD and also affiliated with the ACIP board or committee and the FDA committee that's associated with vaccines.
Mhm.
And he was the spokesperson. And he basically was telling families through the news, getting COVID is so much worse than getting the vaccine,
Which is still a commonly held
which is
belief.
still a commonly held belief.
Yeah.
Oh, I have to add, the other thing she said to me was, so let me give you a little bit of the process of what we did with these kids with myocarditis, is that they did do well with something like ibuprofen. It was very much an inflammatory response.
Yeah.
And so with some of the kids, they would get IVIG. A lot of them, they would get ibuprofen,
Mhm.
and we would be very religious on, the frequency of them getting it to stomp down that inflammatory response within the body. And you would see these kids, if you stopped giving them ibuprofen, their troponin would start going back up,
Hmm.
which was very interesting. As they would stay in the hospital as long as we would see the troponin going down. And then they would be discharged as long as we saw the troponin going down, not normal, but down. They would be discharged and then they would have outpatient appointments.
Mhm.
So, this researcher, one of the things she said to me was that when these kids came back for an MRI of their heart, at that time, about a third of them were having, as she said, scarring on the heart, elevated LGE, which is basically showing scarring. It's scarring. It's a heart tissue that doesn't function anymore.
Yeah, it's like necrotic
It's
cells.
like necrotic cells.
Yeah.
Yep. And so I was like, oh my gosh, if you have someone who has that, that's an adult, you would say the likelihood of them developing congestive heart failure later as their heart naturally ages is very high. And I just remember thinking, what are we setting up these kids for, especially these boys,
Yep.
5 to 10 years from now? What are these boys going to do? And then we had the military being forced to get the COVID vaccine, which I thought was crazy. To be honest with you, I thought
Yeah.
it was crazy because
And now, yeah, and we're in 2021. You've been holding this belief that how this is being handled is not right. So what then happened for you? I mean, my understanding is that you then couldn't take it you had to do something, right? You weren't.
So my community was very involved. San Diego has an amazing community of people who advocate for their community. And so I was invited to talk at one of their community rallies. And then I went to a San Diego supervisor meeting and I spoke there. And then mandates came, and mandates came out by the federal government, and then our state and local governments are all around the summer of 2021. And that was right when the Massachusetts study from the CDC came out, which showed that vaccinated individuals were spreading COVID as well. I knew
Mhm.
that from working in the hospital because a lot of the nursing staff were vaccinated and
And
they
they were
were
still
getting
testing
COVID.
positive for
And they were
COVID.
getting COVID. They were
Yeah.
getting sick. I was at a point where I was like, okay, in all of my advocacy, I never went against the hospital institution. I never attempted to challenge them.
You loved your job.
I loved my job. I, I loved my job. I loved my team.
Mhm.
I loved my team. There were some amazing people that worked there.
Mhm.
And it came to a point, where I wrestled with God and I was like, I knew the beginning of 2021, I knew this snowball was coming. Like I felt it in my soul. I was watching what was happening. I knew it was coming. And I remember going to my husband and saying, I have a feeling I'll probably lose my job if I don't do this. But I can't do this. Like, I can't do this. Every part of my being, of who I am, my spirit, my soul, my personhood, I don't want this. I see this as gene therapy. I see this as transhumanism. And I don't want to be a part of that. And I remember going to him and saying, will you support me even if we lose our house? Even if we lose our cars, our way of life, will you stand by me during this? And I have an amazing husband who said, yes, absolutely. I'll stand by you. Like, you do what you need to do. I started working with another nurse within our hospital because younger nurses were coming to us saying, we don't want to do this. We don't want to have to get this vaccine, because some of them were resistant still to it. We don't want to get this vaccine, but we have student loans. We're just starting out at nurses. Like, this is a career killer.
Mhm.
And I felt like, if not me, then who? If not now, then when? And it was through the strength of developing these deep friendships that I had with these women who were mothers, who were nurses,
Yeah.
and who had not only their own families, but patients coming to them, and friends coming to them, and extended family coming to them, saying, like, I don't want to do this, but I feel like I have to. And so we grouped together and we organized, and one of the things the hospital did was try to shame us by literally wearing the scarlet letter. It was like a neon red badge that we would have to wear.
If you were
if we
unvaccinated?
were unvaccinated. Yeah, so everyone knew who was vaccinated and who wasn't vaccinated. Vaccine status really isn't protected per se under HIPAA.
Mm-hmm.
And so we were very fortunate because California has strong stipulations as to an employer's responsibility of protecting their employees' personal private health information.
Mm-hmm.
And I was able to find, with the help of a very good friend who's a lawyer, find some laws and find some cases that support that. And so I wrote them a letter. And I wrote Rady a letter, and I got a bunch of our group, the nurses within our group, to sign, and respiratory therapists and BAs, which are like secretaries on the unit, to sign their name, which was a huge thing, you know, publicly signing your name to your employer. It felt like, I'm being melodramatic about this, I realize, but it really felt like signing the Constitution, you know,
Mm-hmm.
because you couldn't hide in the shadows anymore. Like your
Yeah.
employer knew who you were.
Yeah. And you're citing your rights.
Yes, yeah.
Mm-hmm.
And so sent that letter to the hospital institution, and fortunately, they decided to change course and not require us to have that, wear that scarlet letter.
So this is just to not have to wear that
Yes.
badge. So this doesn't even necessarily get you out of mandates, but
No.
it just gets you out of having to wear this badge of, what ends up being realistically a badge of shame or
Yeah.
fear,
Yeah.
right?
Yeah.
You win that battle. That's great.
So we win that battle, which is great. Mandates come out soon after that. And I remember going to my supervisor and saying, I will test, I will test, I will mask, I will do all of those things, but I will not get this vaccine. And my supervisor was like, oh, Tawny, it's fine. There are going to be like exemptions for it. And I looked at her and I was like, you don't understand the power behind this.
Mm-hmm.
You don't understand the power behind this.
Were there exemptions?
So legally,
Mm-hmm.
you could have a religious or medical exemption.
Mm-hmm.
What happened was the hospital said, send us in your religious exemptions
Mm-hmm.
or medical exemptions. So people sent them in. And then they started to have to, then the hospital was calling the people that sent in the exemptions, demanding explanations as to how their religion would prevent them from getting the vaccine.
So requesting a religious exemption wasn't enough. You then had to qualify it
Correct.
with some definition.
Correct. And then the hospital realized that probably isn't the best thing to do because that's actually illegal.
Mm-hmm.
Then they said, okay, well, just make sure you send in the exemptions. And then we were supposed to send them in, I want to say by like late August. And then they were going to have a decision for us by early September. And October 1st was the deadline for mandates, where it's CMS. So it was a CMS order. So which is federal. CMS is how Medicare is paid out to hospitals, doctors, any sort of healthcare provider, and they have administrative laws. And so within the administrative law, the Biden administration said under CMS, you have to have 100% of your staff COVID vaccinated.
In order to get paid funds that you've already earned and billed.
Yes. But within that stipulation, because they're government and they know that they are, have to work under federal law, they put in the qualifier of you could have a medical exemption or a religious exemption
Mm-hmm.
and still stay bedside, but you have to be accounted for. the hospital institution would have to keep track of you as the individual, whether you're vaccinated or not vaccinated, and why. August timeframe, as these mandates were coming out, we heard about these mandates. They were issued by CMS. We decided to have a rally. Our group decided to have a rally. And this was when a lot of the nurses across the country were having rallies at different institutions. The institution I worked for is extremely powerful. It's one of the largest institutions in the world. It has basically taken over childcare services in Orange County, San Diego County, most of southern Riverside County. It's huge. I think it's like the 6th largest medical institution in the country. And the amount of child services that they provide is astronomical. It's a nonprofit. And when I looked at their tax returns for 2021, they made after paying out, made over $150 million. So this is a very powerful institution, aligned with state governments. A lot of several of the people that work at the highest executive level are appointed either by Gavin Newsom to be a part of important health committees within the state, or federal committees like this ACIP at the CDC or the FDA. So I really felt like we were going against Goliath, and we did it privately with the badges, and now we are going to do it very publicly with a no mandate rally. And that's what we did.
It was in front of the hospital, right?
It was in front of the hospital.
Where you worked.
Where I worked.
How many people came out for that?
Hundreds. I had spoken with the police beforehand because it is a children's hospital, and Antifa had already decided that they were going to target our rally. And so I was in communication with the local police department. I wanted the police present. I wanted there to be a show of force, so to speak, just that, so people knew to behave.
And the desire is to have a peaceful protest, which is, foundational to this country. I mean, peaceful protest and activism is part of free speech.
I wanted it to be a rally for people to kind of take back ownership of themselves and their decisions. And I wanted it to be something that was positive and about advocacy, because that's what nursing is about, is advocacy. That was my goal behind it. And there was an amazing amount of people. We purposefully didn't have it at the entrance of the building. We had it off to the side. But there were so many people that came, which was pretty amazing. And it was so important for my kids to see.
And it went well. I mean, it
went well.
It was peaceful.
Unfortunately, there was kind of like a scuffle off to the side, and the police were able to contain it. It wasn't anything like super physical or anything like that. It was more just people yelling at each other.
Right.
And the hospital administrator, who is head of operations, in a meeting, all like executive meeting. So it had all the executives, it had all the managers, all the supervisors. There's like 150 people in the meeting, every monthly meeting. She said that 20 people were arrested, and that how disruptive we were and all these things. So I called the police department. I was like, there's 20 people arrested? I didn't even see that. And I was like, can you please get me all the police reports? And they called me back and they were like, no one was arrested. I said, was anyone ticketed? No one was ticketed. And so she tainted the water with that information. This was like right before we were sending in our religious exemptions. She told all the executives and all the managers and all the supervisors of that institution that these people are dangerous.
I mean, this is something we commonly see is personal attacks on character
Yeah.
that discredit
Yes.
what is otherwise a very legitimate movement of concern and advocacy.
I felt so much strength, but I was really fighting to keep my job. I
Yeah.
really wanted to keep my job. I had people who I thought were my friends.
Hmm.
You know, we'd hear the doctors talk about how people who weren't vaccinated, you know, they shouldn't be getting health care. I had a cardiologist flip me off. I had, you know, there were there was really, and this wasn't after the rally. This was like building up. You
Hmm.
know, this was happening. It was kind of like this low rumble that was getting more and more and more and more aggressive. I had people coming up to me and being like, just get the vaccine. Just get the fucking vaccine. What's your problem?
Hmm.
You know, like, don't you want to be safe? Don't you want your patients to be safe? You
Hmm.
know, and I was like, yes, of course I do. You know,
Hmm.
I don't think any of us would live, whether we were vaccinated or not, would be able to live with ourselves knowing that we injured or hurt someone.
But in the back of your head, you've seen the scarring on these children's hearts.
Yes.
And
And
that
you've seen
is,
the myocarditis, the kids with myocarditis coming
yeah.
in. And you've seen the politicization of the vaccine.
Hmm.
And you've seen,
And you see non experts pushing these policies,
and then you see the use of experts to push agendas.
right? The inverse.
Yeah.
Non experts finding experts, telling them this is what expert opinion looks like right now. So go do that.
Yeah.
Hmm.
And so all of this was going on, you know, all at once. And I was doing interviews um, with like local news stations, just trying to help people understand why we are advocating for this, because I really saw this as a as a piece towards taking more and more autonomy away from the patient.
And if a child is injured or you're seeing a flow of children injured, it's part of the Hippocratic oath to tell people what you're seeing and how you're seeing it and why you're seeing it that way.
Correct. At the same time, I was seeing an increase in suicide attempts and suicide ideation in children.
Hmm.
And as I said, I was a charge nurse, so we would get, you know, every shift, twice a day, you're basically in a meeting discussing beds and who needs what and how many sitters we need and who's how many suicide risks we have, because that takes a lot of staff. So, you know, with those children, you have to, those kids need to be one to one, or they need to have a sitter
Hmm.
with them. And so a floor nurse that would usually have 4 patients now only has 1 patient,
Hmm.
or maybe she has 2 patients and a sitter. And so that takes up hospital resources, which was something else that I attempted to speak with our supervisors about, the increase in mental health issues with these children, severe mental health issues with these kids.
Hmm.
It was something that no one was willing to talk about, especially at that time. And that was actually early in 2021, late 2020, early 2021.
The lockdowns and the stay at home orders and the school closures were all around March and April. And so by the end of 2020, there were these kids who had been taken out of society
Mm-hmm.
and required to stay in their bedrooms
Yeah.
for a long time.
And on
Yeah.
social media.
Consuming an enormous
Mm-hmm.
amount of screen time.
Yes.
Hmm.
And not only on their own, but facilitated by our government and school system.
Yeah.
Everything that I knew of as someone in psychology and then studying child and personality development before I went
Hmm.
into nursing school, and then going into nursing school and learning about more child development, everything was against screen time, no screen time,
Hmm.
you know, because it really affected and changed the way children interacted with their world. And now we're pushing screen time. Now, we're facilitating it. Now we are literally mandating it because that's the only way that you could have school.
Yeah.
And the anxiety, just the
Yeah.
anxious energy in society in general. And, these kids absorb all that energy. Really starting to see that in children and how detrimental that was.
And we're still, dealing with it. Kids are having a really hard time. Those aren't years you ever get back.
No, they aren't. And it sets a trajectory for, that child's life experience.
You kept saying, I was trying to keep my job. I love my job. The mandate comes through the hospital. The exemptions are submitted. You're being told that you created a rally, which was incredibly disruptive to the hospital and their arrest, even though there weren't actually arrests. What happened next for you?
Next was the waiting game. It was the waiting game to find out what the hospital was going to do. And we received an email September 25th. And October 1st was going to be the mandate day. Like, either you're vaccinated or you can't.
You can't come to work.
You can't come to work.
Was it implied that you'd be fired?
Yes. If you can't come to work.
Right.
So then we receive an email. Everyone who submitted an exemption received an email. And it basically said, we accept your religious exemption, though due to safety concerns, we can't have you at the bedside. So you have options. You can either become vaccinated and go back to your position, no questions asked, or you can go through a process with HR to find an accommodation. But you cannot have any patient-facing position.
Even though you had been patient-facing for over a year in the peak of the pandemic.
Correct. Even though I tested and wore my mask and did not fight that. I know some nurses did, fight the testing and the masking, but I wasn't one. I felt like that was a good compromise, and that, like I said, I wanted to keep my job, and I wanted to prove that I was safe. I never tested. I didn't test positive for COVID until well after being fired from the bedside. I wanted to show.
Well, and people who were vaccinated were testing positive for
Yes.
COVID, and they were allowed to work.
People who were vaccinated were coming to sick with allergies or head colds. And as a charge nurse on the transplant unit, I was like, you can't do this. You need to go test.
Yeah.
It doesn't matter what you're sick with. It doesn't matter whether it's COVID or something else. You
RSV.
Yes, you can't.
Went around a lot in 2021.
Yes, you can't come to a transplant unit being sick.
What was your accommodation that they provided?
So they said you have 6 months to find some form of an accommodation within the institution, and on March 31st, you will be fired of 2022. You will be fired. And so, once again, several of my friends were like, just take the 6-month leave, like get out of like respiratory season, and you'll be able to come back after respiratory season. And I was like, you guys, no, this is so much bigger than what you think it is. My last shift on the unit, it was very traumatic, but it was a typical busy day. I was doing patient care. I was caring for a heart transplant patient. He was doing okay, but he was going into rejection, something that the nursing staff knew, but the doctors didn't want to admit. And he coded on me right at the end of shift, which is like the hardest time to work through a code. But we were able to get him back in about 10 minutes. And, by the time I left, he was awake and, pointing and talking. And so I
Wow.
I'm so, like, it's just an example of how proud
You just
I
went
am of
hard
that
all the way till the last moment
team.
you were allowed to.
And I felt, as I was walking to my car that day, I texted my friend, Andrea, and I said something to the effect of, God just told me it was my last day. I
Mm-hmm.
remember,
Mm-hmm.
like, deep in my soul, it's like,
Mm-hmm.
it's all about your gut. Like, I'm such a believer in what an average person would call their gut, but I really feel like it's divine discernment in a
Mm-hmm.
lot of ways. And I just remember saying to her, God told me, you're done, Tawny, you're done at the CPICU. You, it's like, he had to show me that I was everything that I had put my energy into. I was worthy to be a nurse in that unit.
You were. You were worthy to be a nurse in that unit and
I
you
was
loved
worthy
it.
to be a nurse in that unit.
Yeah.
And because I struggled after I was removed from the bedside on September 25th, I really struggled with self-worth in a lot of ways, because I was like, I never injured a patient. I never did anything to hurt a patient or hurt families. And I was being removed from something that I felt a deep calling towards.
You helped a lot of people.
And I didn't know if I was ever going to be able to go back to bedside because it didn't look like it at that point. And
And here we are in 2024 where there's still so many of these mandates just to go to school.
yeah, there's still so many
Um,
mandates, but I feel really fortunate because of so many of the women that I embraced and held hands with. I feel like stayed so strong and created space for the rest of society to like catch up with us.
yep.
We held that space.
Mm-hmm. Thank you for that.
You're welcome. Welcome. Like, I just
Yeah.
want to say welcome, everyone.
Yeah.
The hospital would send every week, we'd get a list of jobs available to us.
Mm-hmm.
They were like in the Genomics Institute, they were in all these different like scientific, technical areas that we had
Mm-hmm.
no experience, and
Yeah.
it was a play.
Yeah.
It was a play. Like we would go back to HR and be like, well, I don't know, this job position we might have the skills for this job position, and
Yeah.
HR would be like, no, that doesn't really look like it. It was just a play for
Mm-hmm.
the hospital to say that they tried to accommodate us.
Yeah. I mean, kudos to them for at least trying. Um, and then what happened in March of 2023? Have you exited or what's happened?
So 2022,
Or
and
2022. Yeah.
received a letter from the hospital that I was no longer an employee.
Mm-hmm.
And so we actually do have a lawsuit. A group of us did file a lawsuit against the hospital, and we have our first big hearing in May.
Mm-hmm.
The hospital is attempting to get our lawsuit thrown out.
Of course. Yeah.
Of course. So our first big hearing is in May.
Yeah. What are the rights of individuals today who are losing their jobs? I mean, there's a whole population of Americans that have lost their jobs for refusing to take the vaccine. What is the recourse? Is there any recourse yet?
So what was interesting is I made a claim with the EEOC to basically say my civil rights were not respected, and that I believe I have a case against my employer. And the EEOC also did an investigation, and said that they were going to take our claim forward, but we
Mm-hmm.
had already filed a private lawsuit. I decided to just pursue that instead. There's very few lawyers that are willing to take up these cases, very few,
Mm-hmm.
because there's no money in it.
There's no big precedent that
There's no,
has been set yet.
correct.
So that's really what's coming next is
Yeah.
trying to understand where these freedoms exist in our society. And also, I've been chatting with scientists that had been censored, talking with scientists that have been publishing on adverse reactions of the mRNA vaccines. So it seems like all of these pockets need to kind of happen at the same time, which they are, which is
Mm-hmm.
the good thing. Because once we have the science that backs up
Yeah.
why those mandates were one, infringing on personal freedoms, two, restricting people from economic livelihoods, and three, based entirely on scientific backing that the mRNA posed risks, serious risks to health and well-being. I mean, when you think about, you know, you're what you represent a working mom of young children. What happens when those working moms end up getting sick or falling ill due to a serious reaction to a vaccine? Where is the liability? Because, you're impacting the lives of these children who are losing their parent.
That was one of my really big frustrations. Um, the healthcare industry is one of the largest industries in the United States.
Mm-hmm.
It makes up a huge part of our GDP. And 70%, I just looked this up recently actually, 70% of the healthcare industry are women.
Mm-hmm.
70%. And not only is the healthcare industry filled with women, it's filled with a job that women are able to do and still be mothers, successfully be mothers. Um, and I say that because it's a professional industry.
Mm-hmm.
Overall, you're paid decently, compared to other jobs.
Mm-hmm.
You put in long hours, but you work fewer days a week, so you have more time to be home with your children.
Mm-hmm.
You're able to have a more flexible schedule where you could work around a partner or another parent's schedule.
Mm-hmm.
I traditionally was always very liberal. I became more conservative leaning, if that's what you want to call it. I feel like I've stayed in the middle,
I think
but
you've been you.
yeah,
You've been you, who is somebody who cares deeply, is a person of deep compassion, who seeks out the truth, who's remarkably well educated. I think you've stayed you. I don't see
yeah,
any political difference. I see somebody who maintained their integrity and fought. Um, so this is not a political issue by any measure.
no,
This is an issue of listening to the evidence,
yeah,
watching with care and vigilance, and expressing valid concern. And I think it's happening, but I hope what happens next is that we understand as a society that we can move forward past this real big mistake that
yeah,
was made. I mean, there's no getting around it. How things were handled, the funding streams, the coercion, um, the outright lies.
mm-hmm.
It was all a mistake, and in some cases, I don't think it's my business to say that individuals involved should be held liable because it was such a big, massive coordinated effort. But there's definitely some individuals that had evidence but acted against that evidence. And I think that the great irony of it all is that the theme has been anti-vax, anti-science, and they're willing to throw away the scientific method
Yeah. Yeah.
for what?
Yeah.
For what? I mean, it's very easy to say, well, they were financially motivated, or well, there was some massive conspiracy behind all of this around transhumanism. But to throw away the scientific method, which
Yeah.
is so deeply precious and couched in everything that our society is built on, is it's not worth any of those other things, and it
Yeah.
never will be. For the faith of those individuals that we carry in the scientific method, that faith is stronger because it comes from something that came long before any of these individuals or vaccines were even a thing.
Yeah. Yeah.
Right? This is where Western civilization comes from.
Yeah. It's this idea of curiosity. You know
Yeah.
what I mean? It's this natural idea we all have of this curiosity, and I feel like over time some of it is just stomped out of us. Some of it is just experienced out of us,
Hmm.
but it's so important to keep that love of curiosity.
Yeah, it's foundational.
Yeah.
We can't have a society without that, and part of this is protecting the sanctity of what that is. I fully believe that not only will we overcome, but we are overcoming right now.
Yeah.
So in large part because of people like you. So thank you.
You're welcome. Well, like I said, I just feel very fortunate to be able to be like, here's space, that's
Hmm.
it's important to have the space to be able to stop and analyze what's most important for, you as the individual. And I say that wholeheartedly. I mean, it's not cliche.
Hmm.
It's not a cliche thing that I believe. I really believe that families and individuals need to be able to make those individual choices for themselves,
Hmm.
and that the physical form of our body is an extension. It's just the physical representation of our spirit. I feel very fortunate that there is kind of like this revolution of seeking out, the space to be able to allow yourself to grow and realize that science doesn't have to be separated from nature or the divine. That, like the physical form and the spiritual form of a person, it's one of the same. It's a reflection of the other.